Welcome back, nursing champions. Today is day 7 of our powerful 30 days, 30 practice tests NCLEX challenge, the most trusted shortcut to NCLEX success. If you stay with us and solve all 30 test videos, you'll cover over 2,000 of the most important NCLEX questions. And that's the game changer. This isn't just a challenge, it's a proven technique that has already helped more than 100,000 students pass the NCLEX on their very first attempt. So get ready, because today's test paper is packed with key concepts you can't afford to miss. Let's dive into Day 7. Let us start this with a high-yield cardiovascular question, one that tests both medication knowledge and clinical judgment. The nurse is presenting a continuing education session on cardiovascular medications and highlights an important safety consideration. Which client condition should the nurse emphasize as a contraindication to administering beta blockers? Here are the options. Option A, atrial fibrillation. Option B, myocardial infarction. Option C, congestive heart failure. Or Option D, cardiogenic shock. The correct answer is Option D, cardiogenic shock. Here is the rationale. Cardiogenic shock is a clear contraindication for beta blocker use because these medications are negatively inotropic, meaning they reduce the force of the heart's contractions. In cardiogenic shock, the cardiac output is already dangerously low, often due to a massive acute myocardial infarction. Administering beta blockers in this state would further decrease cardiac output and worsen tissue perfusion. The appropriate treatment instead focuses on urgently increasing cardiac output and stabilizing blood pressure using medications such as dopamine, norepinephrine, dobutamine, or vasopressin. Question 2. Now let us move into an emergency department triage scenario involving pediatric clients. The nurse is prioritizing care for several children and must decide who needs to be seen first. Here are the options. Option A, a 5-year-old who burned her right forearm in scalding hot water. Option B, a 2-year-old who is drooling and refuses to swallow. Option C, an 8-year-old who has had a headache for 2 days. Or Option D, a 10-year-old who reports excessive thirst and has a fever. The correct answer is Option B, a 2-year-old who is drooling and refuses to swallow. Here is the rationale. This child's symptoms raise immediate concern for epiglottitis, a life-threatening upper airway infection that can lead to sudden airway obstruction. The signs of drooling and refusal to swallow suggest that the epiglottis is severely inflamed and swollen, putting the child at high risk for respiratory collapse. This situation demands immediate assessment and airway management. The nurse must promptly notify the healthcare provider and prepare for possible emergency interventions, such as intubation or tracheostomy. Early recognition and swift action are critical to prevent fatal outcomes in suspected epiglottitis. Question 3. Now shifting from emergency care to discharge education, the nurse is reviewing cast care instructions with a client who has just received a fiberglass cast for a fractured radius. The goal is to assess the client's understanding and ensure safe recovery at home. Which statement by the client demonstrates proper knowledge of cast care? Consider the options. Option A, to help reduce swelling, I should keep my arm hanging down. Option B, if the cast feels uncomfortable, I will cut the edges with scissors. Option C, applying a warm compress should help with pain and swelling. Or Option D, if the cast gets a little wet, I will dry it with a towel and use a hairdryer set to cool. The correct answer is Option D. If the cast gets a little wet, I will dry it with a towel and use a hairdryer set to cool. Here is the rationale. This statement reflects accurate understanding of fiberglass cast care. Although fiberglass is more water-resistant than traditional plaster, it can still trap moisture and lead to skin irritation or breakdown. Clients should never use heat or cut the cast, but instead gently pat any moisture with a towel and dry it thoroughly, using a hairdryer on the cool setting for 15 to 30 minutes. This method helps preserve the cast shape while ensuring skin safety and comfort during the healing process. Question 4. Now let us turn to a critical post-procedural nursing situation involving a client who is 24 hours post-angioplasty. During routine care, the client suddenly says, "I do not feel good today. I do not feel like eating." In this scenario, what is the nurse's most appropriate initial action? Here are the options. Option A, ask what the statement means to the client. Option B, delegate an LPN to assess the client. Option C, notify the physician. Or Option D, encourage the client to eat. The correct answer is Option A, ask what the statement means to the client. Here is the rationale. At just 24 hours post-angioplasty, the client remains at high risk for complications such as myocardial ischemia, reocclusion of the vessel, or even bleeding at the catheter insertion site. A vague complaint like not feeling good should never be ignored in this context. The nurse's first responsibility is always thorough assessment. By asking the client to elaborate, the nurse can gather critical information that may reveal signs of chest discomfort, shortness of breath, dizziness, or nausea, any of which could indicate a life-threatening complication. Question 5. Now, let us explore a behavioral health scenario focused on therapeutic communication and safety. The nurse is caring for a client in a mental health unit who becomes verbally aggressive during mealtime in the dining room. The goal is to use language that is both therapeutic and safety conscious. Here are the options. Option A, let us discuss your concerns in a private room with the door closed. Option B, do you want to go to your room or to the quiet room for a while? Option C, I think you should take a few minutes to calm down. Or option D, what is going on right now? The correct answer is option B, do you want to go to your room or to the quiet room for a while? Here's the rationale. This response reflects effective de-escalation techniques while prioritizing safety for both the client and the healthcare team. By offering the client a choice between two safe environments, the nurse provides the client with a sense of control, which can help reduce agitation and prevent escalation. Additionally, this option removes the client from a stimulating and potentially triggering environment. Using calm, respectful language with clear options supports therapeutic rapport and decreases the likelihood of aggression. Struggling with NCLEX prep? Feeling overwhelmed, anxious, or unsure where to start? The Stancoast NCLEX Complete Review course is your shortcut to success. 100 hours of animated crash course, 500 hours of recorded lectures, 5,000 nclex-style questions, 15 NGN mock tests, plus 500 case studies. NCLEX ebook, study planner, and Zoom mentoring 1-year full access. Whether it is your first try or a retake, this course is built to get you licensed faster and smarter. Thousands have trusted Stancoast. Now it is your turn. Enroll today at our website and take the step toward becoming a registered nurse. Question 6. Next, let us review a high-acuity scenario involving sepsis management in the intensive care unit. The nurse is caring for a client who has been admitted with severe sepsis. During the initial phase of treatment, which intervention should the nurse prioritize? Here are the options. Option A, administer prescribed broad-spectrum antibiotics. Option B, initiate invasive hemodynamic monitoring. Option C, administer pain medication to keep the client comfortable. Or option D, administer prescribed corticosteroids. The correct answer is option A, administer prescribed broad-spectrum antibiotics. Here is the rationale. The prompt initiation of antibiotic therapy is the cornerstone of effective sepsis management. Sepsis is a life-threatening condition caused by a dysregulated immune response to infection, leading to widespread inflammation, tissue injury, and potential organ failure. Question 7. Moving from critical care to pediatric respiratory management. The nurse is assessing an 8-month-old infant with a tracheostomy and notices visible secretions that require suctioning. Which suction pressure setting is most appropriate for this infant? Here are the options. Option A, 120 millimeters of mercury. Option B, 90 millimeters of mercury. Option C, 60 millimeters of mercury. Or option D, 40 millimeters of mercury. The correct answer is option B, 90 millimeters of mercury. Here is the rationale. For infants between 1 month and 24 months of age, the recommended suction pressure for tracheostomy care falls within the range of 80 to 100 millimeters of mercury. A setting of 90 millimeters of mercury is ideal, as it provides effective secretion removal while minimizing the risk of mucosal injury, hypoxia, or airway trauma. Pressures higher than this, such as 120 millimeters of mercury, are more appropriate for older children and adolescents. Question 8. Let us now turn to a pharmacological scenario involving fluid and electrolyte regulation. The nurse is caring for a client who is receiving the prescribed medication tolvaptan. Which of the following findings would indicate a therapeutic response to this medication? The options. Option A, fasting blood glucose, 100 milligrams per option A, deciliter or 5.55 millimoles per liter. Option B, urine-specific gravity, 1.10. Option C, total cholesterol, 176 milligrams per deciliter. or 4.55 millimoles per liter. Or option D, blood urea nitrogen 5 milligrams per deciliter or 1.785 millimoles per liter. The correct answer is option B, urine-specific gravity 1.010. Here's the rationale. Tolvaptan is a selective vasopressin V2 receptor antagonist, used primarily to treat syndrome of inappropriate antidiuretic hormone secretion, also known as PSI-ADH. In this condition, excess antidiuretic hormone leads to water retention, concentrated urine, and dilutional hyponatremia. Let us move into a foundational area of client care, nutrition. Question 9. A. Nurse is teaching a client newly diagnosed with iron deficiency anemia about dietary modifications. Which of the following meal choices best promotes iron absorption? See their options. A. Scrambled eggs, whole wheat toast, and black coffee. B. Spinach salad with cheese, white bread, and iced tea. C. Grilled chicken breast, steamed broccoli, and orange slices. D. Peanut butter sandwich on rye bread with a glass of milk. The correct answer is C. Here is the rationale. Because this meal combines a heme iron source, grilled chicken, with a non-heme iron source, broccoli, and includes vitamin C from the orange slices, which significantly enhances non-heme iron absorption. This combination makes it the most nutritionally appropriate choice for managing iron deficiency anemia. Question 10. Now shifting to a pediatric diagnostic scenario, the nurse is assessing an infant with suspected cystic fibrosis. Which stool characteristic would best support this diagnosis? Here are the options. Option A, small, hard, pellet-like stool. Option B, green, malodorous stool. Option C, oily, odorous, bulky stool. Or option D, loose, yellow stool. The correct answer is option C, oily, odorous, bulky stool. Here is the rationale. This type of stool, known as steatorrhea, is a hallmark sign of cystic fibrosis and results from pancreatic enzyme insufficiency. The inability to properly digest fats and fat-soluble vitamins causes large, greasy, foul-smelling stools that often float. This symptom, particularly when seen alongside failure to thrive or chronic respiratory infections, is highly indicative of cystic fibrosis. The other stool patterns listed, such as small pellets or loose yellow stools, may suggest constipation or mild gastrointestinal disturbances, but they do not reflect the malabsorption pattern that is typical of cystic fibrosis. Question 11. Let us look at a procedural safety question involving urinary catheter insertion in a male client. During the procedure, when is the most appropriate time for the nurse to inflate the catheter's balloon? Here are the options. Option A, upon meeting resistance. Option B, as soon as urine is observed in the tubing. Option C, after advancing the catheter to the point of bifurcation. Or option D, after fully advancing the entire length of the catheter. The correct answer is option C, after advancing the catheter to the point of bifurcation. Here is the rationale. Inserting a urinary catheter in a male client requires extra caution due to the longer urethra and increased risk of trauma. Once urine flow is seen, the nurse must continue to advance the catheter until the bifurcation, the wide junction where the drainage and balloon ports separate, is reached. This ensures the balloon is safely within the bladder before inflation. Inflating the balloon too early, such as upon seeing urine or encountering resistance, could result in urethral injury. Once the balloon is inflated inside the bladder, the nurse gently pulls back until resistance is felt and then advances slightly to prevent pressure on the bladder neck. Question 12. Let us now examine an ophthalmologic emergency involving acute angle closure glaucoma. The healthcare provider is caring for a client who is experiencing an acute attack in the right eye. What is the most appropriate position for this client? Here are the options. Option A, Trendelenburg. Option B, supine. Option C, right lateral decubitus with head elevated. Or option D, prone. The correct answer is option B, supine. Here is the rationale. In cases of acute angle closure glaucoma, the supine position can assist in reducing intraocular pressure. This posture allows the lens to fall back from the iris, which helps relieve the pupillary block and partially reopens the iridocorneal angle. This supportive positioning enhances the effectiveness of medications such as mannitol and acetazolamide that lower intraocular pressure. In contrast, Trendelenburg position increases venous and intraocular pressure. The lateral decubitus position may increase dependent eye pressure, and the prone position can worsen angle closure. Therefore, maintaining a supine position best supports the therapeutic goals for this emergency condition. Struggling with NCLEX prep, feeling overwhelmed, anxious, or unsure where to start? The Stancoast NCLEX Complete Review course is your shortcut to success. 100 hours of animated crash course, 500 hours of recorded lectures, 5,000 nclex-style questions, 15 NGN mock tests, plus 500 case studies, NCLEX ebook, study planner, and Zoom, mentoring 1 year full access. Whether it is your first try or a retake, this course is built to get you licensed faster and smarter. Thousands have trusted Stancoast. Now it is your turn. Enroll today at our website and take the step toward becoming a registered nurse. Question 13. Shifting to a trauma care setting, the emergency department nurse is evaluating a client with multiple rib fractures and a nasal fracture after a motor vehicle collision. Which of the following findings requires the most immediate follow-up? Here are the options. Option A, shallow respirations. Option B, chest pain when repositioning. Option C, bruising over the chest wall. Or option D, vomiting. The correct answer is option D, vomiting. Here is the rationale. In the context of facial trauma, vomiting is a red flag that may indicate increased intracranial pressure due to possible traumatic brain injury. Since facial fractures often result from high-impact force, there is a heightened risk of concurrent brain injury. Vomiting is one of the earliest symptoms of elevated intracranial pressure and must be treated as a medical emergency. Immediate action includes notifying the healthcare provider and preparing the client for diagnostic imaging, such as a computed tomography scan. Although shallow breathing and chest wall bruising are expected in rib fractures, they are not as acutely dangerous as signs of rising intracranial pressure. Question 14. Let us move into a post-operative complication scenario. A client who is 2 days post-abdominal surgery reports dull, aching pain in the right calf and tingling in the toes. What is the nurse's most appropriate next action? Here are the options. Option A, elevate the client's legs and encourage hydration. Option B, instruct the client to remain in bed and contact the healthcare provider immediately. Option C, encourage leg massage to improve circulation. Or option D, promote ambulation and educate about the risks of immobility. The correct answer is option B, instruct the client to remain in bed and contact the healthcare provider immediately. Here is the rationale. These symptoms raise immediate concern for deep vein thrombosis, a dangerous post-operative complication. The priority is to prevent any potential embolization by keeping the client still and initiating a rapid medical evaluation. Elevation and fluids may be appropriate later, but not before a diagnostic confirmation. Massaging the leg is strictly contraindicated due to the risk of dislodging a clot, and encouraging ambulation before ruling out DVT could lead to fatal consequences like a pulmonary embolism. Question 15. Next, let us look at a pre-operative scenario. The nurse is caring for a client who is scheduled for spinal surgery in 1 hour. Which medication does the nurse anticipate will be prescribed before the procedure? Here are the options. Option A, gentamicin. Option B, enoxaparin. Option C, hydromorphone. Or option D, cyclobenzaprine. The correct answer is option A, gentamicin. Here is the rationale. Gentamicin is an aminoglycoside antibiotic often used for surgical prophylaxis, particularly in orthopedic and spinal procedures, to prevent infection. It should be administered within 60 minutes of the surgical incision to ensure optimal tissue levels. Enoxaparin, although helpful in DVT prevention, must be withheld before spinal procedures to avoid the risk of spinal hematoma. Hydromorphone and cyclobenzaprine are not typically administered prior to surgery due to risk of sedation and hypotension, making gentamicin the correct and safe choice in this case. Question 16. Moving to pediatric neurodevelopment, the nurse is assessing an infant's neurological reflexes. At what age range should the Moro reflex typically begin to diminish? Here are the options. Option A, 3 to 6 months. Option B, 1 to 3 months. Option C, 7 to 9 months. Or option D, 10 to 12 months. The correct answer is option A, 3 to 6 months. Here is the rationale. The Moro reflex, also called the startle reflex, is a primitive neurological response present at birth. It begins to fade around 3 months of age and usually disappears entirely by 6 months. Persistence beyond this period may indicate neurological delay. Reflexes such as these are essential markers of healthy central nervous system development. and their timely disappearance signifies normal neurological maturation. Question 17. Finally, let us address a medication prioritization scenario. The nurse is beginning a shift and preparing to administer scheduled medications. Which client should be prioritized for immediate medication administration? Here are the options. Option A, digoxin for a client with atrial fibrillation. Option B, furosemide for a client with congestive heart failure. Option C, magnesium sulfate for a client with torsades de pointe. Or option D, labetalol for a client with a blood pressure of 160 over 100 millimeters of mercury. The correct answer is option C, magnesium sulfate for a client with torsades de pointe. Here is the rationale. Torsades de pointe is a life-threatening form of ventricular tachycardia that can quickly deteriorate into ventricular fibrillation. Magnesium sulfate is the first-line treatment and must be given immediately to stabilize the cardiac rhythm. While digoxin, furosemide, and labetalol are important medications, they do not carry the same level of immediate risk as untreated torsades de pointe, making this client the top priority for medication administration. Question 18. Let us now focus on immediate postpartum care. The nurse is assessing a client who delivered vaginally just 2 hours ago. On examination, the nurse notes that the client's fundus is soft and boggy, and she has required 2 perineal pad changes in the last 2 hours. What should be the nurse's initial action? Here are the options. Option A, apply pressure to the fundus. Option B, massage the fundus until it becomes firm. Option C, notify the primary healthcare provider. Or option D, elevate the client's legs. The correct answer is option B, massage the fundus until it becomes firm. Here is the rationale. A soft, boggy uterus in the immediate postpartum period is indicative of uterine atony, the most common cause of early postpartum hemorrhage. The priority nursing action is to perform fundal massage, which stimulates uterine contraction, helps expel clots, and promotes hemostasis. This immediate bedside intervention can significantly reduce blood loss and prevent maternal morbidity. Applying pressure without firming the uterus may risk uterine inversion, and although notifying the provider and supporting circulation are appropriate later, they do not take precedence over this essential nursing action. Question 19. Moving on to a leadership and management scenario, the nurse manager is developing a unit-based council to involve staff nurses in shaping policies, setting priorities, and solving problems collaboratively. Which leadership style is the nurse manager demonstrating? Here are the options. Option A, authoritative. Option B, democratic. Option C, laissez-faire. Or option D, transactional. The correct answer is option B, democratic. Here is the rationale. A democratic leadership style emphasizes collaboration, shared decision-making, and team engagement. By creating a unit-based council, the nurse manager fosters an inclusive work culture where staff feel empowered to participate in policy-making and problem-solving. This approach often leads to improved morale, higher job satisfaction, and more sustainable solutions. In contrast, authoritative leadership is top-down, laissez-faire involves minimal oversight, and transactional leadership focuses on performance-based rewards and lacks team participation. Question 20. Let us now explore a foundational concept in acid-base balance. The nurse is teaching nursing students about the causes of metabolic alkalosis. Which student statement indicates a correct understanding? Here are the options. Option A, hyperventilation. Option B, urinary retention. Option C, opioid toxicity. Or option D, excessive vomiting. The correct answer is option D, excessive vomiting. Here is the rationale. Metabolic alkalosis results from a loss of acid or an accumulation of bicarbonate. Excessive vomiting leads to a significant loss of hydrochloric acid from the stomach, which in turn elevates blood pH and bicarbonate levels. This is one of the most classic causes of metabolic alkalosis. Hyperventilation causes respiratory alkalosis, opioid toxicity causes respiratory acidosis, and urinary retention has no direct link to acid-base imbalance. Question 21. Now let us examine a neonatal case involving abnormal neurological behavior. The nurse is assessing a newborn who was delivered 8 hours ago and notes jitteriness, hyperactivity, and a high-pitched persistent cry. Based on these findings, which condition is most likely? Here are the options. Option A, sepsis. Option B, hypoglycemia. Option C, drug dependence. Or Option D, hypothermia. The correct answer is Option C, drug dependence. Here's the rationale. These findings are characteristic of neonatal abstinence syndrome, a condition caused by in utero exposure to addictive substances such as opioids or benzodiazepines. Signs typically emerge within the first 24 to 72 hours of birth and include jitteriness, hyperactivity, irritability, and a high-pitched cry. While hypoglycemia may cause jitteriness, it is not associated with the same persistent hyperactivity and cry pattern. Sepsis and hypothermia present with lethargy and poor feeding, not overstimulation. Question 22. Transitioning into emergency electrolyte management, a client with diabetic ketoacidosis is receiving intravenous regular insulin. The nurse reviews the lab results and notes a potassium level of 2.9 milliequivalents per liter. What is the nurse's immediate priority? Here are the options. Option A, notify the primary healthcare provider. Option B, stop the regular insulin infusion. Option C, obtain a 12-lead electrocardiogram. Or Option D, assess the client's urine output. The correct answer is Option B, stop the regular insulin infusion. Here is the rationale. Insulin drives potassium into cells, which can further lower an already dangerous potassium level and trigger fatal arrhythmias. In DKA, if potassium is below 3.3 milliequivalents per liter, insulin must be held until potassium is corrected. While notifying the provider and monitoring the ECG are important, stopping insulin immediately prevents further deterioration and is the most time-sensitive action. Question 23. Finally, let us review a high-stakes condition in obstetric care. During handoff report, the nurse learns that a pregnant client has been diagnosed with HELLP syndrome. What does the acronym HELLP represent? Here are the options. Option A, half-eclipsed lipase, levels and preeclampsia. Option B, hemolysis, elevated liver enzymes, and low platelets. Option C, hematocrit elevation, low lipase, and pancreatitis. Or Option D, hemoglobin, elevated lipids, and low plasma. The correct answer is Option B, hemolysis, elevated liver enzymes, and low platelets. Here is the rationale. HELLP syndrome is a life-threatening complication of preeclampsia characterized by systemic inflammation, hemolysis, hepatic injury, and thrombocytopenia. It often presents in the third trimester and requires prompt delivery to prevent maternal and fetal complications, such as liver rupture, placental abruption, or stroke. The other options do not accurately reflect this serious condition and may confuse learners if memorized incorrectly. Question 24. Let us now explore an important area of prenatal assessment, screening for intimate partner violence. During a routine prenatal visit, the nurse is evaluating a pregnant client for possible signs of abuse. Which of the following findings would not typically indicate intimate partner violence? Here are the options. Option A, depression. Option B, weight gain. Option C, unexplained bruising. Or Option D, late initiation of prenatal care. The correct answer is Option B, weight gain. Here is the rationale. Weight gain is a normal physiological change during pregnancy and does not inherently suggest abuse. In contrast, depression, bruising in concealed areas, or delays in seeking prenatal care may all be red flags for intimate partner violence. Victims often avoid medical care due to fear, control by the abuser, or emotional trauma. Nurses must conduct IPV screenings in private using validated tools, offer support services, and document findings objectively for safety and legal purposes. Question 25. Moving into newborn care immediately after birth, the nurse is responsible for preventing heat loss in the delivery room. To specifically prevent radiant heat loss, which action is most appropriate? Here are the options. Option A, drying the newborn skin with a towel. Option B, placing the newborn on a padded covered surface. Option C, using warmed, humidified oxygen. Or Option D, positioning the bassinet away from outside windows. The correct answer is Option D, positioning the bassinet away from outside windows. Here is the rationale. Radiant heat loss occurs when heat is transferred from the baby to a nearby colder surface without direct contact, such as a window or wall. Even if the air in the room is warm, a cold surface can draw heat away. Other actions like drying the baby's skin, using a covered surface, or providing warmed oxygen prevent evaporative, conductive, and convective heat loss, respectively, but not radiant heat loss. Keeping the newborn warm prevents hypothermia, hypoglycemia, and respiratory distress. Question 26. Now let us consider a third trimester complication during emergency assessment. A 38-week pregnant client arrives at the emergency department reporting vaginal bleeding. She appears calm and denies pain. Which client statement would lead the nurse to suspect placenta previa? Here are the options. Option A, I do not feel any pain at all. It is just the bleeding that concerns me. Option B, I feel like I am going into labor. My belly is tightening. Option C, the bleeding started after I picked up my toddler. Or option D, I feel nauseous and may throw up. The correct answer is option A, I do not feel any pain at all. It is just the bleeding that concerns me. Here is the rationale. Placenta previa typically presents as painless vaginal bleeding in the second or third trimester, as the placenta partially or completely covers the cervix. The bleeding is usually bright red and occurs without contractions. Digital cervical exams are contraindicated in these cases until an ultrasound confirms placental location. The other statements suggest labor or nonspecific symptoms, not the classic presentation of placenta previa. Question 27. Let us now move into a client education scenario involving metabolic bone disorders. The nurse is teaching a client newly diagnosed with osteomalacia. Which client statement indicates the need for further teaching? Here are the options. Option A, I have been walking outdoors more often to get sunlight. Option B, I stopped eating dairy products because I do not like them. Option C, I joined a senior exercise program at the local community center. Or option D, I started taking vitamin D supplements daily. The correct answer is option B, I stopped eating dairy products because I do not like them. Here is the rationale. Dairy products are a major source of calcium, and avoiding them without replacement can worsen osteomalacia. The nurse should help the client identify alternative calcium sources or recommend supplementation. All the other responses reflect appropriate strategies to improve bone strength. Sunlight for vitamin D synthesis, exercise to maintain bone mass, and vitamin D supplementation to support mineralization. Question 28. Now let us shift to a high-risk infection control situation in the emergency department. A client presents with fever, neck stiffness, and irritability. What is the nurse's immediate action? Here are the options. Option A, administer prescribed ibuprofen. Option B, place the client on droplet precautions. Option C, notify the public health department. Or option D, obtain prescribed blood cultures. The correct answer is option B, place the client on droplet precautions. Here is the rationale. The classic triad of bacterial meningitis, fever, nuchal rigidity, and altered mental status requires immediate isolation due to the highly contagious nature of pathogens like Neisseria meningitidis. Droplet precautions help prevent transmission through respiratory secretions in crowded clinical environments. Although cultures and fever management are important, infection control is the first step to protect both the patient and others. Question 29. Transitioning into trauma care, a 30-year-old man is brought to the hospital after a head-on collision. He was briefly unconscious, and the paramedic notices clear fluid draining from his nose. A halo test on gauze reveals a clear ring around the blood. What type of fracture does this finding most likely indicate? Here are the options. Option A, depressed skull fracture. Option B, traumatic linear skull fracture. Option C, subarachnoid hemorrhage. Or option D, basilar skull fracture. The correct answer is option D, basilar skull fracture. Here is the rationale. The halo or double ring sign suggests the presence of cerebrospinal fluid leakage, which is strongly associated with a fracture at the base of the skull. This finding requires immediate intervention and careful monitoring to prevent complications like meningitis. Depressed and linear skull fractures may be serious, but they do not typically produce this sign. A subarachnoid hemorrhage presents with different symptoms, such as a thunderclap headache and neurologic changes, not nasal drainage of CSF. Struggling with NCLEX prep? Feeling overwhelmed, anxious, or unsure where to start? The Stancoast NCLEX Complete Review course is your shortcut to success. 100 hours of animated crash, course 500 hours of recorded lectures, 5,000 nclex-style questions, 15 NGN mock tests plus 500 case studies, NCLEX ebook, study planner, and Zoom mentoring 1 year full access. Whether it is your first try or a retake, this course is built to get you licensed faster and smarter. Thousands have trusted Stancoast. Now it is your turn. Enroll today at our website and take the step toward becoming a registered nurse. Question 30. Finally, let us walk through a pediatric emergency step by step. A child is brought to the emergency department with a nosebleed. What actions should the nurse take in correct order? Step 1. Have the child sit up with the neck forward to prevent aspiration. Step 2. Apply continuous pressure to the tip of the nose for at least 10 minutes using the thumb and forefinger. Step 3. If bleeding continues, apply ice or a cold cloth to the bridge of the nose to promote vasoconstriction. Step 4. Offer a drink to help wash away the taste of blood and keep the child calm. Step 5. Reassess to determine whether the bleeding has stopped. This sequence reflects standard pediatric first aid for epistaxis and emphasizes airway safety, comfort, and effective bleeding control. Question 31. Let us begin this section with an important topic in adolescent health education. While speaking at a school health fair, the nurse is educating female students about human papillomavirus, also known as HPV. The nurse correctly explains that HPV is associated with which of the following conditions? Here are the options. Option A, pelvic inflammatory disease. Option B, cervical cancer. Option C, colon cancer. Or option D, ovarian cancer. The correct answer is option B, cervical cancer. Here is the rationale. Human papillomavirus, particularly types 16 and 18, is the leading cause of cervical cancer, due to persistent infection causing abnormal cellular changes in the cervix. The other conditions listed are not caused by HPV. Pelvic inflammatory disease is linked to bacterial infections like chlamydia or gonorrhea. Colon cancer is influenced by genetics, diet, and inflammatory bowel disease, while ovarian cancer is commonly associated with BRCA mutations. Vaccination with HPV vaccines such as Gardasil is highly effective and recommended starting as early as age 9. Question 32. Now moving into newborn care. The nurse is conducting a home visit and observes parents giving their newborn a sponge bath. Which parental action requires follow-up? Here are the options. Option A, removes all of the infant's clothing before starting the bath. Option B, uses a mild soap for cleaning. Option C, provides the bath in a warm room. Or option D, washes and dries one part of the baby's body at a time. The correct answer is option A, removes all of the infant's clothing before starting the bath. Here is the rationale. Completely exposing the newborn may lead to cold stress due to their immature thermoregulation. Instead, only the area being washed should be uncovered, while the rest of the body remains wrapped. The other actions, using mild soap, keeping the room warm, and bathing one area at a time, are all correct and help ensure the infant's safety and comfort during bathing. Question 33. Let us now review a pediatric renal condition. The nurse is assessing a child with glomerulonephritis and notes several symptoms. Which one should be prioritized for immediate evaluation? Here are the options. Option A, presence of periorbital swelling. Option B, noticeable reduction in urine output. Option C, severe headache rated 9 out of 10 on the pain scale. Or option D, presence of blood in the urine. The correct answer is option C, severe headache rated 9 out of 10. Here is the rationale. In a child with glomerulonephritis, a severe headache may signal hypertensive encephalopathy, a dangerous and potentially life-threatening complication. The nurse must check the blood pressure and notify the provider immediately. While periorbital swelling, low urine output, and hematuria are common findings, they do not indicate acute neurological compromise and do not take priority over symptoms of elevated intracranial pressure. Question 34. Next, let us examine therapeutic drug monitoring. A nurse is reviewing lab results for a client on long-term phenytoin therapy. The client's phenytoin level is 12 micrograms per milliliter. What should the nurse do next? Here are the options. Option A, investigate whether the client has been taking the medication inconsistently. Option B, tell the client to hold the next dose. Option C, examine the client for signs of toxicity. Or option D, record the result as being within the therapeutic range. The correct answer is option D, record the result as being within the therapeutic range. Here is the rationale. Phenytoin's therapeutic range is 10 to 20 micrograms per milliliter. A level of 12 falls well within that range and does not require any adjustment or further evaluation unless symptoms of toxicity arise. The other actions would be unnecessary or inappropriate in the presence of a therapeutic and stable drug level. Question 35. Let us shift focus to post-operative rehabilitation. A nurse is caring for a client 2 days after a total knee replacement who is using a continuous passive motion device, also known as a CPM. What is the primary therapeutic goal of this device? Here are the options. Option A, to keep the knee joint stable during walking. Option B, to encourage gradual flexion of the knee joint. Option C, to help reduce swelling after surgery. Or Option D, to decrease the risk of developing blood clots. The correct answer is Option B, to encourage gradual flexion of the knee joint. Here is the rationale. The CPM device promotes passive movement of the knee joint to prevent stiffness, maintain range of motion, and reduce scar tissue formation. It is not intended for use during ambulation, nor is it effective for reducing swelling or preventing blood clots directly. Those goals are achieved through ambulation, compression devices, and pharmacologic thromboprophylaxis. Question 36. Now turning to pharmacologic emergencies, a client receiving fluphenazine develops signs of acute dystonia. Which medication should the nurse anticipate being prescribed? Here are the options. Option A, diphenhydramine. Option B, mannitol. Option C, thiamine. Or Option D, haloperidol. The correct answer is Option A, diphenhydramine. Here is the rationale. Diphenhydramine, an antihistamine with anticholinergic properties, is effective in treating acute dystonic reactions caused by dopamine receptor blockade from typical antipsychotics like fluphenazine. Symptoms include painful muscle contractions, often of the neck and face. Mannitol is used to reduce intracranial pressure. Thiamine treats Wernicke's encephalopathy, and haloperidol is another antipsychotic that could worsen the dystonia. Question 37. Let us apply a calculation to an IV medication scenario. A client with sepsis has been prescribed azithromycin 500 milligrams intravenously once daily. The order specifies dilution in 250 milliliters of 0.9% normal saline to be infused over 60 minutes. The IV tubing has a drop factor of 15 drops per milliliter. What is the correct infusion rate in drops per minute? Using the formula total volume multiplied by drop factor divided by time dash. We calculate 250 times 15 divided by 60. That is, 250 times 15 equals 3,750. Then divide 3,750 by 60, which equals 62.5. Rounded to the nearest whole number, the answer is 63 drops per minute. Here is the rationale. Administering azithromycin at the prescribed rate ensures therapeutic effectiveness and minimizes side effects such as infusion reactions. Nurses must be skilled in IV rate calculations to ensure patient safety and proper antibiotic delivery. Question 38. Let us now explore a pharmacologic safety question involving osteoporosis treatment. The nurse is reviewing the health history of a client who has been prescribed an oral bisphosphonate. Which pre-existing condition would most contraindicate the safe use of this medication? Here are the options. Option A, diabetes mellitus. Option B, hypercalcemia. Option C, lactose intolerance. Or Option D, Roux-en-Y gastric bypass. The correct answer is Option D, Roux-en-Y gastric bypass. Here is the rationale. Clients who have undergone Roux-en-Y gastric bypass have altered gastrointestinal anatomy, which increases the risk for severe esophageal irritation or ulceration when taking oral bisphosphonates. These medications can be highly irritating if not absorbed properly or if they linger in the esophagus. For such clients, intravenous bisphosphonate alternatives may be considered. Diabetes and lactose intolerance do not contraindicate bisphosphonate use, and hypercalcemia may actually be an indication for therapy, not a contraindication. Question 39. Let us turn to postoperative care after urologic surgery. A client has just undergone a cock pouch procedure for bladder cancer. What should be the nurse's initial priority during the immediate postoperative period? Here are the options. Option A, monitor urine output, assess for leaks from the ostomy pouch, and evaluate the size, color, and shape of the stoma. Option B, speak with the client's family to provide updates. Option C, begin stoma and skincare education. Or Option D, perform catheter irrigation as needed. The correct answer is Option A, monitor urine output, assess for leaks, and evaluate stoma characteristics. Here is the rationale. Post-operative assessment of urinary output ensures adequate renal perfusion, while stoma evaluation helps detect early signs of ischemia or necrosis. Leaks from the internal pouch can lead to infection and skin breakdown. The other actions, family communication, education, and catheter irrigation, are important but are not top priorities immediately after surgery. Struggling with NCLEX prep, feeling overwhelmed, anxious, or unsure where to start? The Stancoast NCLEX Complete Review course is your shortcut to success. 100 hours of animated crash course, 500 hours of recorded lectures, 5,000 nclex-style questions, 15 NGN mock tests, plus 500 case studies. NCLEX ebook, study planner, and Zoom mentoring 1-year full access. Whether it is your first try or a retake, this course is built to get you licensed faster and smarter. Thousands have trusted Stancoast. Now it is your turn. Enroll today at our website and take the step toward becoming a registered nurse. Question 40. Now let us move into psychiatric medication safety. A client recently prescribed clozapine is being discharged. What is the most essential teaching point the nurse must emphasize? Here are the options. Option A, maintain a balanced diet to prevent weight gain. Option B, stay well hydrated and engage in physical activity. Option C, be prepared for excessive saliva production. Or Option D, adhere strictly to follow-up laboratory appointment. The correct answer is Option D, adhere strictly to follow-up laboratory appointment. Here's the rationale. Clozapine carries a risk of a granulocytosis, a potentially fatal drop in white blood cell count. Clients must undergo routine blood work, often weekly at the start, to monitor for neutropenia. Without this monitoring, clozapine therapy must be discontinued. While side effects like weight gain or drooling may occur, they are secondary to the priority of blood safety. Question 41. Let us now examine a pediatric scenario involving Kawasaki disease. A 4-year-old is admitted with high fever, rash, red hands and feet, and swollen lymph nodes. Which assessment finding would most strongly support this diagnosis? Here are the options. Option A, listen to heart sounds. Option B, assess capillary refill. Option C, measure blood pressure. Or Option D, inspect the oral mucosa. The correct answer is Option D, inspect the oral mucosa. Here is the rationale. Classic signs of Kawasaki disease include mucosal changes, such as a strawberry tongue, cracked lips, and oral erythema. These findings, along with fever and rash, help confirm the diagnosis early so treatment with intravenous immunoglobulin can be started. Although cardiac monitoring and hemodynamic checks are necessary, oral changes are among the key diagnostic features. Question 42. Next, let us consider a client with Alzheimer's disease who is starting rivastigmine. Which clinical parameter should the nurse monitor most closely? Here are the options. Option A, blood glucose levels. Option B, body weight. Option C, serum creatinine. Or Option D, hemoglobin and hematocrit. The correct answer is Option B, body weight. Here is the rationale. Rivastigmine often causes nausea, vomiting, and loss of appetite, which may lead to significant weight loss. Monitoring the client's nutritional status helps identify early signs of intolerance or malnutrition. Although renal and blood monitoring is always important, rivastigmine does not significantly alter glucose, creatinine, or hematologic values. Question 43. Now let us move into obstetrics and fetal monitoring. A laboring client on continuous fetal monitoring begins to show early decelerations with each contraction. What is the most appropriate nursing action? Here are the options. Option A, reposition the client to her side. Option B, document the fetal heart tracing findings. Option C, stop the oxytocin infusion. Or Option D, prepare for amnio infusion. The correct answer is Option B, document the fetal heart tracing findings. Here's the rationale. Early decelerations are benign and usually caused by fetal head compression during contractions. These mirror the timing of contractions and are not a sign of distress. Therefore, no intervention is needed beyond documentation. Repositioning, stopping oxytocin, or amnio infusion are interventions for non-reassuring patterns, not for normal findings. Question 44. Now for a medication safety check. The nurse is reviewing prescriptions before medication administration. Which order requires clarification? Here are the options. Option A, warfarin for a client with an international normalized ratio of 1.8. Option B, digoxin for a client with a potassium level of 3.1. Option C, enoxaparin for a client with a platelet count of 155,000. Option D, lisinopril for a client with a creatinine of 0.6. The correct answer is option B, digoxin for a client with a potassium level of 3.1. Here is the rationale. Hypokalemia increases the risk of digoxin toxicity. With a potassium level this low, digoxin should be held and potassium corrected first. The other medications are appropriate based on the lab values provided. Question 45. Let us review heart failure management. A client with systolic heart failure is being treated with carvedilol. Which finding would best indicate a therapeutic response? Here are the options. Option A, increased urinary output. Option B, improved ejection fraction. Option C, progressive ventricular remodeling. Or option D, elevated BNP level. The correct answer is option B, improved ejection fraction. Here's the rationale. Carvedilol improves left ventricular function by reducing sympathetic nervous system activity, and a rise in ejection fraction confirms therapeutic success. Increased BNP or ventricular remodeling suggests worsening heart failure, and while increased urine output may occur, it is not carvedilol's primary effect. Struggling with NCLEX prep? Feeling overwhelmed, anxious, or unsure where to start? The Stancoast NCLEX Complete Review course is your shortcut to success. 100 hours of animated crash course, 500 hours of recorded lectures, 5,000 nclex-style questions, 15 NGN mock tests plus 500 case studies, NCLEX ebook, study planner, and Zoom mentoring. 1 year full access. Whether it is your first try or a retake, this course is built to get you licensed faster and smarter. Thousands have trusted Stancoast. Now it is your turn. Enroll today at our website and take the step toward becoming a registered nurse. Let us begin with question 46, which focuses on safe medication practices with high alert drugs. A client receiving fentanyl through patient-controlled analgesia reports worsening pain, prompting the nurse to obtain a new prescription to adjust the PCA settings. Now, what should the nurse do immediately after making the prescribed changes to the PCA device? Here are the options. A. Verify the updated settings with a second nurse. B. Educate the client about the potential side effects of fentanyl. C. Reposition the client to enhance comfort through non-pharmacological means. Or D. Reassess the client's pain level to determine medication effectiveness. The correct answer is option A. Verify the updated settings with a second nurse. This is essential because fentanyl is a high-alert opioid, and safety protocols require double verification by 2 licensed nurses before changes to PCA settings are finalized. This verification ensures accurate administration and prevents medication errors. Educating the client, repositioning, or reassessing pain are important steps, but they come only after confirming the settings are correct. Next, let us move to question 47, which shifts our focus to neurological symptom management. A client with multiple sclerosis presents with worsening muscle spasticity. Which medication should the nurse expect the healthcare provider to prescribe? Your choices are A. Topiramate, B. Risperidone, C. Prazosin, or D. Baclofen. The correct answer is option D. Baclofen. This centrally acting muscle relaxant is widely used to reduce muscle spasms in clients with multiple sclerosis, improving mobility and decreasing fatigue. In contrast, topiramate is an anti-epileptic agent, risperidone is an antipsychotic, and prazosin is typically used for blood pressure or nightmares, not spasticity. Clinically, spasticity in MS often requires pharmacologic support, and options like baclofen, tizanidine, or benzodiazepines are commonly utilized to relieve discomfort and support functional independence. Now on to question 48, which focuses on pediatric pharmacology. A child with nocturnal enuresis has not responded to behavioral interventions. Which medication should the nurse anticipate the healthcare provider will prescribe? Your options are A. Urecoline, B. Desmopressin, C. Prazosin, or D. Finasteride. The correct answer is option B. Desmopressin. This medication mimics antidiuretic hormone and reduces urine production at night, helping children manage bedwetting. Urecoline may worsen symptoms by promoting bladder contractions. Prazosin and finasteride are used in adult populations for entirely different conditions, and have no role in treating pediatric enuresis. Clinically, desmopressin is reserved for cases unresponsive to alarms or bladder training and must be administered with fluid restrictions to prevent water intoxication. Let us continue with question 49, which tests knowledge of gastrointestinal assessments. During a teaching session, a nurse asks student nurses which condition most commonly results in hyperactive bowel sounds. Which response reflects the best understanding? The options include A. Paralytic ileus, B. Gastroenteritis, C. Late-stage bowel obstruction, and D. Peritonitis. The correct answer is option B. Gastroenteritis. This condition increases peristalsis, resulting in loud, frequent, high-pitched bowel sounds. In contrast, paralytic ileus and peritonitis reduce motility and lead to hypoactive or absent bowel sounds. Late-stage obstruction also slows activity, although hyperactive sounds may be present early on. Clinically, remember to always auscultate bowel sounds before palpation, and know that hyperactive sounds often indicate increased motility, such as in diarrhea or stimulant laxative use. Moving on to question 50, we turn our attention to newborn prioritization. The nurse has just received a handoff report on 4 infants in the nursery. Which newborn should be assessed first? The choices are A. A 3-hour-old weighing 6 pounds, B. A 4-hour-old delivered at 42 weeks gestation, C. A 6-hour-old measuring 21 inches, and D. An 8-hour-old delivered at 40 weeks. The correct answer is option B. A 4-hour-old newborn delivered at 42 weeks gestation. Post-term infants are at higher risk for complications such as hypoglycemia and respiratory distress due to meconium aspiration and reduced fat stores. While the other newborns show normal findings, this infant's post-term status places them in a critical window for early monitoring. Clinically, post-term newborns require close observation for temperature regulation, respiratory status, and blood glucose in the first few hours after birth. 51, which highlights cardiovascular pharmacology. The nurse is caring for a hospitalized client receiving continuous phenylephrine infusion for hypotension. Which statement best describes this drug's mechanism of action? Your options include A. A parasympathetic neurotransmitter for digestion and heart rate, B. A hormone from the adrenal cortex that manages glucose, C. A sympathomimetic alpha agonist that causes vasoconstriction, or D. A hormone from the posterior pituitary regulating water retention. The correct answer is option C. Phenylephrine is a sympathomimetic drug acting on alpha-adrenergic receptors to induce vasoconstriction and elevate blood pressure. It is used in hypotensive emergencies, including septic shock or anesthesia-related hypotension. The other options refer to unrelated physiological roles. Clinically, close monitoring of blood pressure, heart rate, and infusion sites is essential when administering this potent vasopressor. Question 52 focuses on mental health and defense mechanisms. A school nurse is assessing a student upset after failing an exam. The student admits to not studying, but angrily blames the teacher. Which defense mechanism does this represent? The options are A. Undoing, B. Projection, C. Compensation, or D. Intellectualization. The correct answer is option B. Projection. This occurs when someone attributes their own negative feelings or behaviors to someone else. In this case, the student displaces blame to avoid internal guilt. Undoing involves symbolic attempts to erase negative behavior. Compensation is using strengths to offset weaknesses, and intellectualization uses logic to detach from emotional stress. Clinically, nurses should recognize defense mechanisms in students or patients and respond with empathy and strategies to support accountability. Let us now turn to question 53, which highlights the importance of prioritization in client assessment. The nurse has just received handoff reports for 4 clients. Which one should be assessed first? The options are A. A client receiving albuterol via nebulizer who reports feeling nervous during the treatment, B. A client awaiting a home health referral following a recent total hip replacement, C. A client who is 6 hours post-operative from a hysterectomy and is experiencing nausea, or D. A client who reports their arm feels asleep 3 hours after a cast was applied for a fracture. The correct answer is option D. A client who reports their arm feels asleep 3 hours after a cast was applied for a fracture. This symptom may signal early compartment syndrome, a serious complication caused by increased pressure within a confined tissue space. leading to decreased circulation and potential permanent nerve damage. Symptoms such as tingling, numbness, and paresthesia are early red flags, while nervousness from albuterol, nausea post-hysterectomy, and discharge planning after hip replacement are all important. They do not pose the immediate risk of permanent loss of function. Clinically, always prioritize signs of compromised circulation, especially after casting or trauma. Now let us explore question 54, which addresses home safety education. The nurse is teaching a community safety class about environmental hazards within the home. Which gas can be detected using a simple and affordable device similar to a smoke detector? The options are A. Ozone, B. Nitrous oxide, C. Carbon monoxide, or D. Carbon dioxide. The correct answer is option C. Carbon monoxide. Carbon monoxide is an invisible, odorless, and deadly gas produced by incomplete combustion of fuels like wood, gas, and coal. CO detectors function much like smoke alarms and are essential for household safety. Ozone and nitrous oxide are not common residential concerns, and while carbon dioxide detectors exist, they are typically used in industrial settings, not homes. Clinically, carbon monoxide poisoning can cause nonspecific symptoms such as dizziness and headache, progressing to loss of consciousness or death, making detectors a vital preventive tool near fuel-burning appliances and sleeping areas. Struggling with NCLEX prep? Feeling overwhelmed, anxious, or unsure where to start? The Stancoast NCLEX Complete Review course is your shortcut to success. 100 hours of animated crash course, 500 hours of recorded lectures, 5,000 nclex-style questions, 15 NGN mock tests plus 500 case studies, NCLEX ebook, study planner, and Zoom mentoring. 1 year full access. Whether it is your first try or a retake, this course is built to get you licensed faster and smarter. Thousands have trusted Stancoast. Now it is your turn. Enroll today at our website and take the step toward becoming a registered nurse. Moving forward to question 55, we focus on prenatal care and RH incompatibility. A 28-week pregnant client with blood type A negative is advised to receive an intramuscular Rho-D immune globulin injection. Which client statement indicates a misunderstanding and requires clarification? The options are A. This shot is meant to prevent my baby from developing antibodies against my blood, right? B. If we find out my baby is Rh positive, I will need another one of these shots after birth. C. This injection helps protect me in future pregnancies, but I will need it again if I have another Rh positive baby. Or D. This medication stops me from producing Rh antibodies. The correct answer is option A. This reflects a misunderstanding. It is the mother's immune system, not the baby's, that might produce antibodies. Rho-D immune globulin prevents the mother from becoming sensitized to Rh-positive fetal blood. All other options accurately describe the purpose and timing of the injection. Clinically, remember that sensitization is irreversible. So giving Rho-D immune globulin after delivery, miscarriage, or trauma is critical in preserving future pregnancies. Now, let us proceed to question 56, which shifts focus to medication safety in mental health care. The nurse is reviewing medications for a client with schizophrenia. Which drug is associated with QT interval prolongation on an electrocardiogram? The options include A. Cariprazine, B. Ziprasidone, C. Mirtazapine, or D. Diazepam. The correct answer is option B. Ziprasidone. This atypical antipsychotic poses a dose-dependent risk of QT prolongation, raising the danger of torsades de pointes. An electrocardiogram and electrolyte monitoring are essential before initiating therapy. Cariprazine is an atypical antipsychotic, but does not prolong QT. Mirtazapine and diazepam do not have QT prolonging effects. Clinically, it is crucial to recognize which psychiatric medications may impact cardiac conduction and avoid combining them with other QT prolonging drugs. Let us move into emergency endocrinology with question 57. The nurse is caring for a client experiencing a thyroid storm. Which medication should be expected as part of emergency management? The options are A. Enalapril, B. Regular insulin, C. Levothyroxine, or D. Dexamethasone. The correct answer is option D. Dexamethasone. This corticosteroid decreases peripheral conversion of thyroxine to triiodothyronine, helping to rapidly lower active thyroid hormone levels. Enalapril is not preferred in thyroid storm management. Insulin is used for diabetic crises, and levothyroxine would worsen the hyperthyroid state. Clinically, thyroid storm management includes beta blockers, antithyroid drugs, corticosteroids, and supportive measures like cooling and cardiac monitoring, never aspirin, which increases circulating thyroid hormone. Let us continue with question 58, which focuses on common pregnancy discomforts. A pregnant client in her third trimester reports frequent leg cramps at night. Which dietary change should the nurse recommend? The options are A. Increase magnesium-rich foods, B. Consume more iron-rich foods, C. Add vitamin C to the diet, or D. Eat more phosphorus-containing foods. The correct answer is option A. Increase magnesium-rich foods. Magnesium supports muscle relaxation and neuromuscular function. Leafy greens, seeds, and nuts are excellent dietary sources. Iron and vitamin C have unrelated functions, and phosphorus can actually contribute to muscle irritability when excessive. Clinically, nurses should also advise calf stretches, hydration, and warm baths to manage leg cramps, while persistent symptoms may prompt lab evaluation. Now we arrive at question 59, which highlights anxiety pharmacotherapy. A client with generalized anxiety disorder is being evaluated for medication. Which of the following is a selective serotonin reuptake inhibitor, SSRI? The choices are A. Venlafaxine, B. Paroxetine, C. Alprazolam, or D. Duloxetine. The correct answer is option B. Paroxetine. This SSRI increases serotonin levels and is used for long-term treatment of anxiety and depression. Venlafaxine and duloxetine are serotonin norepinephrine reuptake inhibitors, while alprazolam is a benzodiazepine suitable only for short-term use. Clinically, SSRIs are first-line treatments due to their safety profile, though nurses should remind clients that symptom relief may take several weeks and initial side effects are common. See question 60, which centers on pain management in oncology. A client with metastatic cancer experiences sudden, severe breakthrough pain. Which medication should be given for immediate relief? The options are A. Fentanyl via transdermal patch, B. Pregabalin, C. Ketorolac, or D. Hydromorphone. The correct answer is option D. Hydromorphone. This intravenous opioid is fast-acting and appropriate for managing acute pain spikes in cancer clients. Fentanyl patches offer long-term control but have delayed onset. Pregabalin treats neuropathic pain and is not suitable for sudden pain, and ketorolac is not strong enough for severe cancer pain. Clinically, it is crucial to distinguish baseline from breakthrough pain and respond rapidly with potent opioids when warranted. Let us now dive into question 61, which focuses on the critical care assessment following chest tube insertion. After assisting with the placement of a chest tube in a client with pneumothorax, which post-procedure assessment finding indicates that the intervention was successful? The options are A. Consolidation noted on chest X-ray, B. Clear bilateral breath sounds, C. Rapid bubbling in the suction control chamber, or D. Crepitus noted at the insertion site. The correct answer is option B. Clear bilateral breath sounds. This finding confirms that the lung has re-expanded and is functioning properly, which is the desired outcome of chest tube placement. Consolidation, bubbling, or crepitus may indicate complications such as infection, air leaks, or subcutaneous emphysema. Now, let us continue with question 62, which examines psychopharmacology in eating disorders. A client recently diagnosed with bulimia nervosa is starting medical treatment. Which medication does the nurse anticipate will be prescribed? The options are A. Metformin, B. Bupropion, C. Fluoxetine, or D. Clozapine. The correct answer is option C. Fluoxetine. This selective serotonin reuptake inhibitor is the only medication approved by the United States Food and Drug Administration for the treatment of bulimia nervosa. It reduces the frequency of binge purge cycles and is most effective when paired with behavioral therapy. Bupropion is contraindicated due to the risk of seizures, especially in purging clients. Metformin and clozapine are used for unrelated conditions. Let us now shift our focus to antipsychotic medications with question 63. The nurse is preparing to administer haloperidol to a client. Which condition is this medication most commonly used to manage? The options are A. Dementia, B. Schizophrenia, C. Major depressive disorder, or D. Bipolar disorder. The correct answer is option B. Schizophrenia. Haloperidol is a first-generation antipsychotic that effectively treats positive symptoms of schizophrenia, such as delusions and hallucinations. It works by blocking dopamine receptors in the brain. It is not used to treat depression or dementia and should be used cautiously in older adults due to the risk of mortality in dementia-related psychosis. Let us move on to question 64, which concerns thyroid medications. The nurse is assessing a client taking methimazole for hyperthyroidism. Which report requires immediate notification of the healthcare provider? The options are A. Body mass index of 23, B. Complaints of a sore throat, C. Pulse rate of 84 beats per minute, or D. Presence of a mild skin rash. The correct answer is option B. Complaints of a sore throat. This symptom may indicate a granulocytosis, a rare but serious adverse effect of methimazole that leads to dangerously low white blood cell counts. A sore throat in this context may be the first sign of infection and warrants immediate evaluation and a complete blood count. Other options do not reflect urgent concerns. Let us address question 65, which emphasizes post-surgical infant care. The healthcare provider is supervising a newly hired nurse caring for an infant immediately following cleft lip repair. Which action requires immediate correction? The choices are A. Repositions the infant to the prone position, B. Obtains the infant's temperature via the axillary route, C. Cleans the surgical suture line with normal saline, or D. Keeps suction equipment available at the bedside. The correct answer is option A. Repositions the infant to the prone position. Prone positioning places pressure on the surgical site, increasing the risk of wound dehiscence, pain, and aspiration. Infants after cleft lip repair should be positioned supine or upright to protect the incision. All other options are appropriate post-operative practices. Now moving into maternal health with question 66. The nurse is evaluating a 31-week pregnant client presenting with facial puffiness, swollen hands, and a persistent frontal headache. Which intervention should the nurse perform first? The options are A. Measure fundal height to assess fetal growth, B. Check vital signs, especially blood pressure, C. Perform Leopold maneuvers to determine fetal position, or D. Insert an indwelling urinary catheter to check output. The correct answer is option B. Check vital signs, especially blood pressure. These symptoms are hallmark indicators of preeclampsia, a hypertensive disorder of pregnancy. Blood pressure assessment is the immediate priority to determine the presence and severity of hypertension. While fundal height, fetal position, and urine output may be relevant later, none of them take precedence over confirming maternal blood pressure status. Clinically, untreated preeclampsia may lead to eclampsia, requiring swift diagnosis and management with medications and potential early delivery. Struggling with NCLEX prep? Feeling overwhelmed, anxious, or unsure where to start? The Stancoast NCLEX Complete Review course is your shortcut to success. 100 hours of animated crash course, 500 hours of recorded lectures, 5,000 nclex-style questions, 15 NGN mock tests plus 500 case studies, NCLEX ebook, study planner, and Zoom mentoring. 1 year full access. Whether it is your first try or a retake, this course is built to get you licensed faster and smarter. Thousands have trusted Stancoast. Now it is your turn. Enroll today at our website and take the step toward becoming a registered nurse. Next, in question 67, we address a pediatric emergency. A child diagnosed with intussusception is admitted for care. Which description best defines this condition? The options include A. An intestinal segment sliding into another, causing obstruction, B. Absence of nerve cells in the colon, leading to megacolon, C. Inflammation localized to colon mucosa and submucosa, or D. Ongoing cycles of constipation and diarrhea. The correct answer is option A. An intestinal segment sliding into another, causing obstruction. Intussusception is a telescoping of the intestine, which causes obstruction and can compromise blood supply to the bowel. Hirschsprung disease, ulcerative colitis, and irritable bowel syndrome are unrelated conditions. Clinically, signs include sudden abdominal pain, vomiting, and current jelly stools. Prompt reduction with air or contrast enema is often effective, but surgical intervention may be required in complicated cases. Let us now transition to pediatric oncology in question 68. A child with a diagnosed Wilms tumor is being assessed. Which finding would the nurse anticipate? The options are A. Heart rate above normal, B. Slow respiratory rate, C. Low blood pressure, or D. Elevated blood pressure. The correct answer is option D. Elevated blood pressure. Wilms tumor, a nephroblastoma of the kidney, often secretes renin, which leads to hypertension due to increased fluid retention. Hypotension and bradypnea are not typical findings, and tachycardia alone is too nonspecific. Clinically, the abdomen should never be palpated in these children to prevent rupture of the tumor capsule. Blood pressure monitoring and surveillance for renal and gastrointestinal compromise are crucial in ongoing care. Shifting our focus to fluid and electrolyte balance in question 69, the nurse is assessing risk for hyperkalemia. Which condition places a client at the highest risk? The choices are A. Cushing's syndrome, B. Acute renal failure, C. Cystic fibrosis, or D. Bulimia nervosa. The correct answer is option B. Acute renal failure. When the kidneys fail, they cannot adequately excrete potassium, leading to life-threatening elevations in serum levels. Cushing's syndrome and bulimia usually cause potassium loss, and cystic fibrosis often leads to electrolyte imbalances, but not hyperkalemia. Clinically, signs of hyperkalemia include muscle weakness, arrhythmias, and ECG changes such as peaked T waves. Treatment may involve insulin with glucose, calcium gluconate, or emergency dialysis if levels are critically high. Now for question 70, we look at nursing skills and safety during procedures. The nurse is supervising a newly hired nurse during nasogastric tube insertion. Which action requires immediate correction? The options are A. Advancing the tube during the client's inspiration, B. Providing the client with water and a straw, C. Elevating the head of the bed to 90 degrees, or D. Washing the bridge of the nose with soap and water. The correct answer is option A. Advancing the tube during the client's inspiration. This greatly increases the risk of the tube entering the airway instead of the esophagus, potentially causing aspiration or respiratory distress. Safe practice involves encouraging swallowing while advancing the tube. All other options reflect correct and safe procedural steps. Clinically, always verify tube placement through aspirate testing or X-ray before using the tube for feeding or medication. Let us now revisit pharmacological safety in pregnancy with question 71. A female client is prescribed isotretinoin for severe acne. Which laboratory test is most critical before initiating therapy? C. The options are A. Pregnancy test, B. C-reactive protein, C. Bun and creatinine, or D. Prothrombin time. The correct answer is option A. Pregnancy test. Isotretinoin is highly teratogenic and can cause severe birth defects. A negative pregnancy test is mandatory before starting and must be repeated monthly. The other tests are not directly required for initiating isotretinoin therapy. Clinically, women must be enrolled in the iPledge program and use 2 forms of contraception during treatment. Nurses should also monitor for hepatotoxicity and mood changes while educating clients on sun protection and adherence. And finally, question 72 wraps up this segment with a focus on infection prevention. The nurse is educating new staff about urinary catheter care. Which statement should be included in the teaching? The options are A. Sterile gloves should be used to perform catheter care. B. Urinary specimens may be collected from the catheter bag. C. You may irrigate a catheter with warm water for poor outflow. Or D. Daily use of soap and water should be used around the urinary meatus. The correct answer is option D. Daily use of soap and water should be used around the urinary meatus. This helps prevent infection and skin irritation and is done with clean, not sterile, gloves. Urine samples should never be taken from the bag. And catheter irrigation requires an order and should use normal saline. Clinically, nurses should also keep the catheter tubing secured, the collection bag below bladder level, and monitor for signs of infection or poor urine output. We will see you in next video.